symptoms of BPH.
Well, that's the perfect transition to our next topic. Let's discuss some of the clinical data for Cialis for once-daily use. As you may know, Cialis has been studied in a number of trials in men with ED, ED plus BPH, and BPH alone. For the purpose of today's discussion, we'll focus on the data in men with ED plus BPH and in men with signs and symptoms of BPH. Please take a moment to review the safety information on the screen. We did not study Cialis in combination with alpha blockers because of the potential for hypotensive effects. There are now 4 clinical trials in the Cialis label that provide evidence for the treatment of men with ED plus BPH or BPH only. Study L was conducted in 408 men with ED plus BPH, and studies J and K were conducted in 410 and 325 men, respectively, with BPH only. Lastly, the most recent addition to the label, study LVIW, was conducted in 696 men with the signs and symptoms of BPH and an enlarged prostate. I just want to point out that this data can be found in the prescribing information or on cialismd.com if any of our viewers would like to take a closer look. Now, all studies were designed with a washout period and a 4-week placebo lead-in period with eligibility criteria requiring patients to have a total IPSS greater than or equal to 13 at the start of the placebo lead-in period. That put all patients in the range of moderate to severe BPH symptom severity. Study LVIW included men with BPH symptoms and an enlarged prostate. That was a prostate greater than 30 cc's. So, what are your perspectives on the study information? Do most of your colleagues realize that the Cialis studies included only men with moderate to severe symptoms of BPH? And if so, what is the clinical significance of this fact?
I think the study design was solid as well as conservative. For example, the washout period and the 4-week placebo lead-in period, it was important to make sure that there were no drugs in their systems before the trial began. And since we don't treat men with mild BPH, including those with moderate to severe BPH, it also makes sense clinically and supports the study results.
I know the IPSS scale is not typically used in practice, but do you think that it translates well into practice?
I don't use the actual scale with patients, but I cover the questions from the IPSS. They align with what you'd ask naturally, so I don't really stick to a scale. What it represents is important, but implementing it day to day is not practical. I'd rather ask the questions in a more conversational manner, like, are their symptoms bothersome enough to treat with a medication? So what it really comes down to is, does the patient want to start a medication?
Let's take a look at study L in patients with both ED and moderate to severe symptoms of BPH. IPSS baseline scores were 18.5 for the tadalafil group and 18.2 for the placebo group. Mean change from baseline in total IPSS at week 12 was negative 6.1 for Cialis 5 milligrams for once daily use, compared to negative 3.8 for placebo, with a p-value of less than 0.001. What does a 4 to 6 point drop mean to physicians in clinical practice?
The literature supports that a 3-point drop is considered clinically meaningful. But what I also think about is asking my patients about their sense of bother and did the medication help to improve their symptoms. For me, the data from this study, as well as the 2 additional studies in men with BPH, demonstrate that Cialis for once daily use is effective.
Yes, the data looks good and it works for me. I don't overthink the process. If you have both conditions, you can take Cialis once daily. It's the only approved drug on the market to treat both, and it's relevant to my patient population.
Let's discuss LVIW, the last clinical study added to the label, which shows that in a population of men with symptoms of BPH and an enlarged prostate, Cialis 5 milligrams for once daily use plus finasteride resulted in an improvement in total IPSS versus placebo plus finasteride, starting at 4 weeks and continuing through 26 weeks of treatment. That was the duration of the study. What about this patient population that had an enlarged prostate, that being greater than 30 cc's?
It's an important addition to the label because it confirms that Cialis once daily is effective in treating the symptoms of BPH, regardless of how severe those symptoms might be. This study gave the patient population who responded the opportunity to experience early symptom relief.
Please note that the LVIW data includes the following limitation of use. If Cialis is used with finasteride to initiate BPH treatment, such use is recommended for up to 26 weeks because the incremental benefit of Cialis decreases from 4 weeks until 26 weeks, and the incremental benefit of Cialis beyond 26 weeks is unknown.